Pharmacology of thyroid hormones. The thyroid gland facilitates normal growth and maturation by maintaining a level of metabolism in the tissues that is optimal for normal function. The two major thyroid hormones are triiodothyronine, which is more active than thyroxine. Inadequate secretion of thyroid hormone cause hypothyroidism, which lead to bradycardia, cold intolerance, and mental retardation in children, and physical slowing. By contrast, excess secretion of thyroid hormones, which is called hyperthyroidism, can cause tachycardia instead of bradycardia, cardiac arrhythmias, body wasting, nervousness, tremor, and heat intolerance. The thyroid gland is made up of multiple follicles that consist of a single layer of epithelial cells surrounding a lumen filled with thyroglobulin, which is the storage form of thyroid hormone. Thyroid function is controlled by TSH, thyroid stimulating hormone, which is synthesized by the anterior pituitary. The hypothalamic thyrotropin release hormone, TRH, controls the generation of TSH. That's to say, when concentration of thyroxine in the blood is decreased, this will cause a stimulation for the hypothalamus to release thyroid releasing hormone, and in turn this will stimulate the anterior pituitary to release thyroid stimulating hormone. The action of thyroxine and triiodothyronine is mediated by cyclic AMP and leads to stimulation of iodide uptake by the thyroid gland. Oxidation to iodine by a peroxidase is followed by iodination of tyrosines on thyroglobulin. Antibodies to thyroid peroxidase are a diagnostic for Hashimoto's thyroiditis, which is a common cause of hypothyroidism. Condensation of two diiodotyrosine residues give rise to T4 or thyroxine, whereas condensation of monoiodotyrosine residue with a diiodotyrosine residue generate T3. The hormones are released following proteolytic cleavage of the thyroglobulin in the storage. Here are the synthesis of thyroid hormones and the sites of action of some drugs. Now, the thyroid trapped iodide from plasma and transport them to inside the thyroid. Inside the thyroid, iodide will be converted by the action of peroxidase enzyme to convert iodide into iodine. Iodine starts to react with tyrosine. One iodine with the tyrosine will form monoiodotyrosine, and two molecules will form diiodotyrosine. This will be stored in the thyroglobulin, and then when the body need these hormones, it will be released by the process of proteolysis to push these hormones into the plasma, T3, or in the blood, T3 and T4, and then in the periphery, T4 will be converted to the more active T3. Now, the transport of iodide to inside thyroid will be inhibited by thiocyanate and perchlorate. And that's why ingestion of some food like cauliflower and cabbage continuously might inhibit this pump, which is known as iodine pump, and may cause hypothyroidism. The other side of action is to prevent the coupling, iodination and coupling of iodides with tyrosine. This step will be inhibited by thionamides. Now, iodides also inhibit the process of proteolysis, and therefore there is less hormone to be going to the blood, and conversion of T4 into T3 is inhibited by radiocontrast media, beta blockers, corticosteroids, and amiodarone. Here is the control of release. As we said, hypothalamus will be stimulated to release thyroid releasing hormone, and then this will stimulate the anterior pituitary to release TSH, thyroid stimulating hormone, and then thyroid gland will release 3 types of hormones, T3, T4, and calcitonin. Now, calcitonin is synthesized in the parathyroid hormone and is responsible for calcium metabolism and control the distribution of calcium. Most circulating T3 and T4 bound to thyroxine binding globulin in the plasma, which is the transporter. The hormones must dissociate from thyroxine binding globulin prior to enter cells of the thyroid. In the cell, 2,4 is enzymatically deiodinated to 2,3, which enter the nucleus and attack to specific receptors. The activation of these receptors promotes the formation of RNA and subsequent protein synthesis, which is responsible for the effects of thyroxine. And this mechanism of action is exactly the same as corticosteroids. The drug will enter into the cell, combine with a receptor, and the combination of receptor and the hormone will go to inhibit release of normal messenger RNA and will produce certain messenger RNA which mediate the actions of these hormones. Both thyroxine and triiodothyronine absorbed after oral administration. Food, calcium preparations, iron salts, and aluminum containing antacids can decrease the absorption of thyroxine. Therefore, thyroxine is better to be given 30 minutes before food to prevent this interaction. Deiodination is the major route of metabolism of T4. The hormones are also metabolized by conjugation with the glucuronides and sulfate and excreted into the bile. Treatment of hypothyroidism. Of course, we have deficient of thyroxine and triiodothyronine, so we have to give these hormones in hypothyroidism. Hypothyroidism usually results from autoimmune destruction of the gland and is diagnosed by elevated thyroid stimulating hormone. That's to say, when we have hypothyroidism, there is excessive TSH, but when we have hypothyroidism, there is deficiency of TSH. Levothyronine, which is thyroxine, is preferred over liothyronine or the combination of T3 and T4 by a certain ratio in a combination called Liotrix for the treatment of hypothyroidism. Levothyronine is better tolerated than T3 preparation and has a longer half-life. It is dosed once daily and steady state is achieved in 6 to 8 weeks. Toxicity is related to the thyroxine levels and manifest as nervousness, palpitation, and tachycardia, heat intolerance, and unexpected or unexplained weight loss. Drugs that induce the cytochrome P 450 enzymes such as phenytoin, rifampin, and phenobarbital accelerate metabolism of thyroid hormones and may decrease effectiveness. Now, in the other hand, the treatment of hyperthyroidism or thyroid toxicosis, Graves' disease, which is an autoimmune disease that affects the thyroid, is the most common cause of hyperthyroidism. Graves' disease, TSH levels are low due to negative feedback mechanism. Feedback inhibition of TRH occurs with high levels of circulating thyroid hormone, which in turn decreases TSH. The goal of therapy in the treatment of hyperthyroidism is to decrease synthesis and or release additional hormone. They can be accomplished by: number one, removing part or all of the thyroid gland, which is called partial thyroidectomy, inhibition of thyroid hormone synthesis, blockade of hormone release, use of radioactive iodine. Here also, this table explain also the treatment of hypothyroidism and hyperthyroidism. In hyperthyroidism, we are going to use either T3 or T4. In hyperthyroidism, we have to use thionamides, antithyroid drugs, iodide, Local's iodine. Local's iodine can be prepared by using 5% iodine and 10% of potassium iodide, and also beta blockers and radioactive iodine. When we can use radioactive iodine, this is used when thyroidectomy cannot be done due to serious diseases or coexisting diseases or age, and when there is possibility of malignancy. The thyroid cell is destroyed by radioactive iodine, the isotope 131, which is selectively taken by thyroid follicular cells. Most patients after radioactive iodine become hypothyroid after radioactive iodine and require levothyroxine supplementation for the rest of their lives. Inhibition of thyroid hormone by thionamides. We have two thionamides, methimazole and propylthiouracil. These are concentrated in the thyroid where they inhibit both the oxidative processes required for iodination of tyrosine group and the condensation coupling of iodotyrosine form T4 and T3. Thionamides have no effect on thyroglobulin already stored in the gland. Therefore, the action of the drugs will not appear until thyroglobulin stores are depleted, which take about 8 weeks. Methimazole is preferred over propylthiouracil because it has a longer half-life, allowing for once daily dosing. However, propylthiouracil is recommended during the first trimester of pregnancy due to great risk of teratogenic effect with methimazole. Propylthiouracil has been associated with hepatotoxicity and agranulocytosis, which is rare. Here the side effects of thionamides. The overall incidence of side effects constitute about 5%, mild leukopenia 12 to 25%, agranulocytosis 0.1 to 2.5%, aplastic anemia, thrombocytopenia, cholestasis, hepatocellular necrosis, lupus-like syndrome, nephrotic syndrome, and to less extent nausea and vomiting, pruritus, skin rash, urticaria, loss of taste. A blockade of hormone release. A pharmacological dose of iodide inhibits the iodination of tyrosines, but this effect lasts for a few days. That's to say, iodides cannot be used for indefinite time. More importantly, iodide inhibits the release of thyroid hormone from thyroglobulin by unknown mechanism. Iodide is employed to treat thyroid stone or prior to surgery to make the thyroid gland firm and will be easier for the surgeon to use his knife. In this case, iodine will be given in the form of logos iodine, which is iodine potassium iodide in water, distilled water. Iodide is administered orally and it is not useful for long-term therapy. The thyroid ceases to respond to the drug after a few weeks. Iodine tincture, which is iodine in alcohol. Also, we use potassium iodide as a solvent or facilitate the solubility of iodine. So iodine tincture in alcohol used as antiseptic externally, and povidone iodine is used in sterilization before surgery. They will sterilize the skin, and this povidone iodine is the soluble type of iodine in water. Adverse effects of iodine include sore mouth and throat, swelling of the tongue or larynx, rashes, ulceration of mucous membranes, and metallic taste. Thyroid stone can be treated, or thyroid stone presents with extreme symptoms of hyperthyroidism. The treatment of thyroid stone is the same as for hyperthyroidism, except that drugs are given in higher doses and more frequently. Beta blockers such as metoprolol or propranolol are effective in blunting the widespread sympathetic stimulation that occurs in hyperthyroidism, and usually thyroid stone takes place during the operation, and it is an emergency situation. Thank you very much.